Hey everyone, it's Dr. Kalie Reams here, and I'm going to be showing you manual lymph drainage for the right arm chest area, okay? This is a general description. This is more to be an adjunct with some manual lymph drainage by a professional trained in this, whether it be a physical therapist, massage therapist, occupational therapist. This is also going to help a little bit with prevention if you're early on, right? But there are modifications to all of these, so this is just a generic thing. If you have a lymph therapist in your local area or live in Chattanooga or surrounding area, reach out to me for any modifications you may need, but this is a good overview, okay? What you need to be aware of throughout all of this is the lymph system lies right underneath the skin, okay? So we're just going to be gently moving the skin, not doing a deep tissue massage, okay? Just the skin, okay? The whole purpose of manual lymph drainage is to help get the lymph fluid to healthy lymph nodes. So if you've had lymph node dissection, radiation, mastectomy, whatever it may be, these lymph nodes have been impaired. So we want to get them to healthy lymph nodes. Those healthy lymph nodes are in our neck, the opposite side, or down in our hip. Okay, so we're going to be stimulating those other areas and helping guide that fluid to those healthy lymph nodes, all of them to help with the load here. We don't want to just go to one because then we can overwhelm that one section. Okay, keep in mind, we pump fluid 24 hours a day. Okay, so manual lymph drainage alone will not be enough. Okay, what's usually followed up is with compression, exercise, and proper skincare. That's called complete decongestive therapy. Okay, again, this is just an overview. So my right side is the one that's affected. The first move we do is just a hey, wake up. So my collarbone is right here. I'm going to go right underneath of it, just gentle strokes. I'm not even moving the skin on this one. Just gently kind of patting and saying, wake up. All of these are going to be done in sets of 10. That is not some magic number. It basically means do more than 2, but don't do it all day long. Okay, so you will see I don't count, but I'm going to do it around 10 times. Next, our collarbone is right here, right, or mine is, and then that muscle that we all love to get knots in, right, is right there. There's a soft spot kind of in between it, both sides, okay? I'm just going to gently press down. Now you can see via the shadow kind of right here, I'm not choking myself, right? I'm just gently pressing down. I do both sides with my arms crossed because this is really awkward on my wrists. So I like to cross, okay? And our neck is so small, it's a good idea to do both sides rather than just the one. Okay, after about 10 presses here, what you're going to do is come to the side of your neck. Okay, now if you notice, I'm below my jaw, my ear, but I'm not kind of down on the shoulder. I'm directly on my neck. Okay, so we're going to push back and then down. So I'm creating an L, so moving my skin back towards my spine and then down towards the shoulder. This is the stroke we're going to be using for the rest of the massage, okay? Just enough to move the skin, creating that L stroke. The whole purpose is if we're trying to get fluid to this lymph node, or these lymph nodes, sorry, we want to go perpendicular towards, perpendicular towards. Now this can be done on both sides. Perpendicular towards, right? Again, arms crossed because this is uncomfortable to me, but do what's best for you, okay? Now you can see my hands are flat. I'm not gripping in, I'm not pinching, okay? About 10 of those. Now, after that, we come to the edge of the shoulder here, okay? We're gonna be pulling fluid towards the neck. So we kind of got this area revved up. So now we're going to go from the tip of the shoulder, we're going to go perpendicular towards, perpendicular towards, perpendicular towards. It usually takes me about 3, okay, of those to get to my neck. That counts as 1, all right? And you can see it's not a big movement. You can see my shirt is not getting pulled completely off of my arm because I'm not pulling really hard, okay? It's just a gentle top of the skin type massage. My hand is always relaxed because I need my hands the rest of the day, the rest of my life, right? So I don't want to wear them out. Okay, after about 10 of those, we're going to come over to the left armpit. My hand is up in that armpit, okay? Again, hand is relaxed like this. I'm not grabbing. Right here, we're gonna wake up the lymph nodes in the left armpit, or rev them up, really. They're awake. We're just gonna kick them into gear a little bit more. So across and up. Now you notice when I pull up, I'm not shoving my shoulder up in my ear. Gentle, gentle, gentle. The reason I keep repeating this is most common when I teach people in person. What I see is they want to go hard. They want to get this fluid out. It's not going to help you. It'll actually cause more fluid, okay? So stay gentle. All right, after about 10 of those, now we're going to pull fluid from the right to the left, okay? So we start at the left armpit. We're going to go perpendicular towards, perpendicular towards, perpendicular towards. Now my wrist gets funky here, so I switch hands. Perpendicular towards. I'm still going to my left. Okay, again, it counts as one once I make it all the way across. I do about 10 of these. Now this is where some of those modifications come in. Some people have had breast cancer on one and then a couple years later on the other one, so now they don't have healthy lymph nodes on either side. Okay, if that's the case, or if you're like, this doesn't make sense for me, reach out to your local lymphedema therapist, email me. If you live in the Chattanooga area, reach out to me. We can set an appointment to modify more to you. Remember, this is adjunct. This is not meant to replace. There we go. That's roughly 10. Okay, so now we've pulled to the neck. We've pulled to the opposite armpit. We're now going to pull down to the hip. So my hip bone is right here. My pubic bone's right here. I'm just resting my hand just gently inside the hip bone, okay? Perpendicular up towards the belly button. So really I'm kind of finding that angle of my hip, pushing down into it, and then up towards my belly button. Down, up. Just the skin. I'm not doing a bowel massage, okay? I don't need to be moving around my breakfast because it is morning when I'm recording this. All right, about 10 of those. Okay, again, I'm not counting on this video. This is more demonstration, not the full count, okay? We've revved those lymph nodes up. Let's pull fluid towards them. So get into that right armpit, okay? Now, you do not have to lift your arm up. I'm doing that so you can see. You can purely just stick your hand in there, okay? I know sometimes range of motion is difficult. So we pull perpendicular towards. So I'm pulling across and down. Perpendicular towards. And then I'm moving my hand down towards that hip where I just revved up those lymph nodes, right? Now, you can see I am on the side of my chest, okay? Kind of pulling that chest across. For those of you who have larger breasts, if you lay on your side and kind of have gravity pulling out of the way, that can help. Manual lymph drainage can be done sitting, laying down, standing from the shower, wherever you want. For the purpose of this video, I'm doing it sitting, okay? It is best if you do skin on skin. So the skin of your hand directly on the skin of wherever you're massaging. But I want this video to stay up, so I'm going to show you over clothes. And you can absolutely do it this way. I have patients do it in the shower. I have patients who do it on their lunch break when, you know, they're in their private office. It's wherever you can find time to do this and perform it. And this does not replace anything. This is just to help keep things moving so fluid doesn't stay stagnant. Okay, we want it going to those healthy ones. That's about 10 there. So now that we've gotten the trunk all revved up and moving, let's try and pull some of that fluid up out of the arm. So if my arm's straight out like this, I'm going to divide my arm into 4 places. Upper inside, upper outside, lower inside, lower outside. I'm going to start with the upper inside, right at the bend of my elbow. We're pulling fluid towards the trunk. That way it can get redirected to those areas we just told it to. So perpendicular towards, perpendicular towards. You can kind of see my skin stretch here if you look, right? I am not hurting my hand. I am not pushing my arm anywhere. I am purely moving the skin. Again, about 10 complete strokes from elbow to shoulder. Okay. Roughly 10 of those. We're going to move on now to the back of the arm. Okay, so there's my wonderful elbow. Yes, I have funky elbows. Perpendicular towards. This should make sense by now, right? You did it everywhere else. Those L strokes. So I'm pulling across and up. And my hand is just curved around my arm. I'm not grabbing onto it. I'm just taking to the contour of the arm. Roughly 10 of those. All right, so I'm gonna put my hand up here so you guys can see. So I'm gonna go the inside lower, perpendicular towards, perpendicular towards. Now, to give it a good extra massage, I'm gonna go all the way up my arm, okay? This isn't necessary for everyone, but if you're not sure, why not? It doesn't take that much longer, right? All the way up. Most people do not get swelling on the inside of their hand, but when we flip to the other side, you'll see I do the back of the hand. If for some reason you have swelling down here, you can do the hand, okay? There's no rule against it. All right, roughly 10 of those, right? Now, several people get swelling in the back of their hand, down into their fingers. So you can start down here in that same L stroke, right? So I'm going across my hand, up towards the shoulder. So across, up, across, up. Imagine drawing an L, and I'm gonna work my way all the way up to the shoulder. Again, it doesn't take that much longer, and it kind of gives that extra oomph. Okay, some people I don't show this to because they don't need it. So we're gonna keep doing that. There we go. I don't know what my hand did in that last one. Okay, roughly 10 of those. So that is for the right arm. Now, like I said, typically this is followed up with compression. If we're working on getting swelling out of your arm, that means compression bandages. If this is a maintenance thing to keep fluid from getting back in your arm, that means a compression sleeve. As I mentioned, we pump fluid 24 hours a day, so we need something to help with that fluid the times we're not massaging. Exercise is very important because our muscles act like a pump to push the fluid up. So it can be wrist curls, elbow curls, shrugs, playing with your kids, whatever it may be, move that arm, okay? Last part of this is diaphragmatic breathing. Our lymph system starts deep within our organs. So if we can get a really good pump from the back, it's kind of like a back pressure pushing that fluid out, right? And so I'm going to show you laying back. Again, you can do this in any position. My hand is down here. My thumb is right near my belly button, just to give you a reference. My other hand is up on my chest. When I breathe in, you can see my lower hand moves, my right one really doesn't come up. I'm breathing down into my belly, deep breathing. Okay, this is kind of creating a massage deep inside near our organs to pump that fluid and give that back pressure to get it moving out. Where this lymph fluid goes is it gets filtered, pulls out some of the gunk, pulls out some of the water, right? Gets pumped back through our venous system, and any extra fluid gets passed on to our kidneys. We then urinate out. So if you are urinating or going to the bathroom more after doing this, good sign we're getting fluid out, okay? So expect that. Don't worry about that. Follow up with myself or with a manual lymph drainage therapist if this is something new to you. If this is something I've assigned you and you're watching the video, good job. I'm glad you're watching it. Reach out to me if you guys have any questions.